Well, when you first know that you've got diabetes, it's not unusual to have an emotional reaction to it. And this can show up as denial, anger, confusion, stress, anxiety and depression. And this shows itself up at times with not picking up your medication, not making appointments, not getting blood tests. So if any of those things are happening or going to happen, you need to think about whether one of these things is happening to you. There are a number of things you can do to help yourself cope with diabetes. These are asking lots of questions of your doctor or practice nurse, trying to get as much information as you can about that, particularly on diet, exercise and medications and perhaps blood tests. If you're having particular emotional problems, there's a number of things you can do about that. Again, that would be important to let your doctor and practice nurse know that they are issues. And there are some things you can do for yourself, like getting exercise, having a look at the John Kirwan website, talking to your minister. There's a bunch of things you can do. And if you have a particular issue you want to work on, we often use a system called problem solving. This is where you identify a specific problem, think about a range of solutions, and you can sometimes ask a friend to help you with those solutions. Pick one of them that you'd like to work on and then work on it. And this is something you can do repeatedly and will involve you perhaps setting a goal every week, and then you can start building up your skills in coping with your diabetes. In summary, it's not unusual to be confused or scared when you first get the diagnosis of diabetes, but in my 30 years of working in South Auckland, most of my patients live perfectly well with diabetes, whether they be Samoan grandmother, age 65, a 55-year-old Māori kaumātua, and with all stages of diabetes. So using some of the strategies we talked about before, it's quite possible to enjoy life and be in control of your diabetes.
The great way of managing and taking care of your diabetes is attending the Diabetes Self-Management Education Program. So if you're newly diagnosed with diabetes, go and ask your nurse or your GP to make a referral. It's available through your DHB. It's free and it's funded by your DHB. All it needs is your willpower, your commitment and motivation to learn more and more about your diabetes. Through this program, you will have more understanding about diabetes, what's happening in diabetes, what are the myths and what are the facts around diabetes, and also knowing your numbers. So when you're looking at your blood reports, you know what these numbers mean, and also learning about monitoring and managing your diabetes through using the blood glucose monitor, as well as learning about your medication, that why you're taking this medication, why it's important, and what is the action of these medications onto your blood sugar levels. It also emphasizes on lifestyle changes like healthy eating, physical activity, and why it's important to be physically active if you want to control your blood sugar levels and you want to manage your diabetes. And you will also learn the self-management tools and techniques like asking for support. We welcome family members, we welcome whānau, we welcome support person to come along with you so they can learn how you are living with type 2 diabetes. At the same time, they can support your learning. And I see this as a great opportunity for our children to learn more about diabetes and also to prevent themselves falling into the trap of lifestyle that leads to the diabetes. So Diabetes Self-Management Education Program, we call it Diabetes Self-Management Empowerment Program, because this program empowers you. It gives you the tools and techniques of self-management to be your own manager. So you get the knowledge, you get the skills, you get the confidence, and you get all the empowerment, and it enables you to actually take control, deal with it, and live a quality of life.